In this video, we're going to cover visual discomfort. So with visual discomfort, we had a bit of a talk about lighting and the effects of staring at your screen too much. So in this video, we'll cover it in a little bit more detail with what consequences you can face with visual discomfort. Some symptoms actually include sore red eye or dry watery eyes, gritty or heavy eyes, blurred vision, and it even leads to a headache. Check out this video for more information on one particular syndrome in general.
Hi, I'm Rebecca Brayton and welcome to WatchMojo.com, and today we're speaking with Dr. Langis Michaud about an important eye health issue that may be affecting many Canadians, computer vision syndrome. The majority of Canadians may not even know they suffer from this condition, but if the symptoms are left undetected, they can lead to increased discomfort and eye and vision strain. So what is CVS, or computer vision syndrome?
Computer vision syndrome is defined by optometrists as an ocular fatigue occurring while the patient is doing computer work or BlackBerry work or any kind of electronic device that is seen at near distance. The lighting of the device itself can create the ocular fatigue, but the environment is very important. So if you have some reflection on the screen, if the lighting around the screen is too low or too bright, that can also contribute to create the ocular fatigue. Patients will first of all have that fatigue around the eyes and have difficulty to complete their task. It's possible to have redness, photophobia, meaning that the light is disturbing to our vision, blurred vision, diplopia, meaning we begin to see double. These elements are symptomatic of the computer vision syndrome.
Is there any age group in particular where we're seeing more of an incidence of symptoms in terms of CVS?
The possibility to get a sharp and clear focus at near distance is reduced with aging. By the age of 30, we have to develop a little bit more our accommodation at near distance. That's even worse after 40, and obviously after 45 we cannot do the effort.
Is it possible that I suffer from CVS and I don't even know it?
Yes, most of the people will consider normal these symptoms because everybody around them can have exactly the same thing, but it's not normal to have headaches, irritation on the eye or around the eyes.
How often should people get their eyes examined?
By the age of 23, 24, 25, the vision is habitually stable, so every 2 years. For contact lens wearers, annual exam is required. Over 40 or 45 years old, because there are some changes in the vision, we ask again to see the patient every year. And obviously older than that, because of the pathology that is possibly occurring without any symptoms in the eye, it's very, very important to see your optometrist or your ophthalmologist every year.
What would happen if CVS was left untreated?
Discomfort, first and foremost. At a given point, you can create some chronic headaches. It's treatable, reversible, but you won't be comfortable doing your regular work.
What are some other ways that I can prevent eye strain when staring at a digital screen?
We have a rule in optometry that we call the 20-20-20 rule, meaning that for every 20 minutes of work at near distance, you have to make a pause of 20 seconds and to look at least at 20 feet in distance, or just to close your eyes for very few seconds in order to alleviate the fatigue to occur. Second, to control the environment, the lighting of the screen, the contrast on the screen. The third thing is to wear the correction, the contact lenses or the glasses as recommended by your optometrist or your ophthalmologist.
Notice how the video was similar and aligned with the video that we covered with our lighting, and it covered a little bit more detail to what kind of symptoms that you face, right down to even just using your phone at night time with the lights off. And even thinking about that, the idea of watching television with no lights on in the background and what damage that can do for your eyes. Take a look at your workbook under visual discomfort and prepare yourself for the next activity.